Hi, good morning, everyone. Welcome again to our conversation with Jorie at the ViVE conference in Los Angeles, 2026. Today, I'm joined with my daughter, who's going to interview me here for her school, University of Miami School of Nursing and Health Sciences. And we'll see. Working with my daughter here today is kind of unusual, a little irritating at some points, but it'll be fun.
It's bring your kid to work day.
Nevertheless, she has a public health project, and it falls right in line with what we're doing here at ViVE. So, Emily Lowe.
Hi, I'm Emily Lowe. I'm a student at the University of Miami. Like he said, I'm studying public health, and I am working on a project right now. It's an intervention-based course where we're trying to make the world a better place and implementing public health benefit in healthcare companies that exist already. So I'm lucky enough to be working with Jorie and to be here today to educate myself and educate my peers back at school on how AI could help the healthcare force today.
Well, all right, Emily, go ahead and hit me up with the questions.
All right. So why do you think that it is important to educate people on how AI can help healthcare in a public health stance, rural hospital based or healthcare administration burnout?
That's a good question. So, obviously technology, we're a technology organization, AI, artificial intelligence, machine learning, et cetera. We need to deploy automation so that it could have the greatest advantage for reaching out into some of our rural communities. In public health, sometimes people don't have the access to the care. Obviously, AI and technology seems so very far away from their existing needs when we could actually utilize it to bridge the gap. What I mean by that is that our AI could give you the workforce of 500 people. And in our rural communities, they just don't have those people available to serve those communities. So things like telehealth, remote patient monitoring, to be able to give a care delivery to the community, crossing geographic boundaries, you're going to start seeing some of that. It's not going to transform overnight, but when you start implementing some of these processes that now you have a patient being cared for by a virtual doctor anywhere in the world, it's going to be interesting to see how that kind of evolves into a model that now enhances public health in general and drives costs down.
I think it's very obvious, especially in those rural communities, that administrative burnout and overworking is just common due to the lack of the staffing and the location base and resources. So when you implement AI, what do you see benefiting the system, and how Jorie actually reduces that burden in the real workforce to put more attention on those patients?
Yeah, when we talk about more attention to those patients, the obvious one that sticks out is the rural community. But really, AI doesn't care. It'll go across everywhere, including your inner city. It kind of balances out and streamlines the care delivery across the board, which is so cool because we pick on the pain points across the nation. But yes, you'll see it kind of evolving over time and kind of streamlining the care, not only in those rural communities, but it's going to streamline the care in your inner cities and patients that are having a difficulty with their health care where they don't have the best insurance. So AI is one of those technologies that you want to deploy. So I call it the great equalizer. It allows us to deliver care in a way where it doesn't matter if you have the best insurance or not. AI is going to be able to come knocking on your door and give you advice.
So you call it a great equalizer. I think that AI is kind of a controversial topic in a way where it could be replacing people, but also some people don't really enjoy the idea of technology taking over their lives because of the fact that they've worked in these normal workforces without it for so long. So in 5 to 10 years, how do you see students implementing AI when they're learning and trying to get into the healthcare workforce? How do you think that they should be working on it now so that in that time range, when it takes over more, they're prepared for that adjustment.
Yeah, let's talk about the future. The students are really key, because by the time I'm long and gone, they're the ones that are carrying the baton. They're the ones that are defining the rules for AI. I just want to say that there should be guardrails around AI, but don't block AI. It's coming. You have to be able to embrace it. Mm-hmm. A lot of people have fear that AI is going to kill people. And I'll be honest, it can if it's done incorrectly. Like, for example, I was just talking to a doctor that was saying that, well, AI, if it does his job, that's fine. But if it learns on its own and it learns the wrong thing, it'll do it 100 times over and over and over again until we're following the AI's direction as a doctor. Understood. But to put guardrails around that is really key, because we need AI. Why? Because 600,000 people are dying every year just from the manual process of misdiagnosis. Mm-hmm. So it's like a kind of a balance. Right now, people are dying just from the normal healthcare mistakes, and AI could prevent that. But you also don't want AI to make gigantic mistakes as well. And so there has to be guardrails around it. Where we're at is we're building the infrastructure for the AI, all the interconnectivity, the connections into the 3,500 insurers, the back and forth, the financial burdens that are being placed on our health systems because of the claims. That'll evolve into care delivery as it kind of moves towards ambient listening and moves towards the surgical interventions, et cetera. So it's going to be exciting to see that evolve in the next several years to come.
So AI should be used as a tool to make everyone's lives easier and better and flow when used correctly, versus more of a challenge.
Well, yeah, absolutely. I mean, AI is, to think about AI, artificial intelligence, and the costs associated with it. You hear of the billions, if not trillions of dollars that are going to be poured into AI today. That should not be something that we deploy that makes our lives complicated. It should be the opposite of that, right? So AI is meant to streamline your life. Imagine you train AI one time to do the work of 500 people. Mm-hmm. And then that's exciting to see.
So what do you say about people that are worried about the transition into AI and implementing that into a hospital if they're worried about it becoming complicated?
Say again,
the transition into AI in the hospitals.
Are they worrying about their jobs, things like that?
Yes, like the transition to implement it in their day-to-day life in a environment where they're already just having...
I think those that don't embrace AI, because AI is coming, will lose their jobs. Mm-hmm. Those that embrace AI will keep their jobs and enhance their jobs. I think the bottom line is that AI is going to be part of our lives. It's going to... If it's just like one of your skill sets, mm-hmm. You're probably using AI today in school.
Every single day.
Every single day. There's no way you can stop it.
And it's not replacing my work. It is helping me move faster, smarter, organize my life a lot better.
I'm a lot older than you. So when you think about it, when we're doing spreadsheets, Excel comes around and it's like, wow, and we thought that it was going to get rid of all these jobs. Instead, we've increased our jobs. There's more accountants than ever. So with that said, I mean, I think the idea and the fear factor always comes with technology that is transforming. And I take it all the way back. We've always been transforming all of our lives, from typewriters to computers, et cetera.
You just have to welcome it in.
The ones that embrace it are going to be the best at using AI. You're going to be the best computer operator. You're good at your laptop. You're good at your mobile phone. What if you stayed with your typewriter because you were fearing it?
You fall behind. And
right? So, I mean,
lives would be lost.
Exactly. So a lot of people are like, all right, Elon Musk is going to make all these robots. I don't want to buy one. Guess what? I'm the first one to buy one. Mm-hmm. I'll be the first one to buy one.
Awesome. I think working on this project with Jorie has taught me that we shouldn't be telling people to work harder, but telling people to embrace systems that are making their lives easier and making them work more efficiently, to have a better work environment and a better place to then benefit everyone, and especially in under like served areas where they need the help the most. It's the most important. That being said, years from now, how would you want healthcare leaders to look back on your role in Jorie and how you played in hospitals to support their teams?
I'm a microscopic piece to the entire puzzle. But if I do one thing that gets us to the next thing, then I did my job. I think that when you get an opportunity like Jorie, it gives you more options to be able to do things, to make a difference. And what I think people don't understand, like everyone has thousands and thousands of ideas, but to actually get the opportunity to execute, literally you have to build something like Jorie. So we can't take that lightly. Like, it's not about like, hey, you're the CEO of Jorie. You have this global company. You've accomplished your job. No, what it does is it gives us the opportunity to make decisions in the healthcare industry that other people don't, like modernizing Medicare and Medicaid systems. Who's going to give somebody that just has that idea that job to do that?
Right.
They're going to give Jorie that job if we have the infrastructure to accomplish it. So you have to understand that everyone gets a certain opportunity in their life to do something. And as you go through school, you'll be also given those opportunities.
I think it just shows that you've worked hard to get to the top, and now you're going to use your technology and the connections you've made to help benefit others around you. And I think that that's really powerful as like a huge company in healthcare.
Yeah, I mean, we're not a huge company, but the idea is that can we bring other companies together to create the momentum into the marketplace and do what I call transformation. A lot of technology companies are really looking to make one solution, maybe flip it and make some money out of it, there's nothing wrong with that. It's a free economy. What we're doing is we're looking at transformation. Did we help transform a healthcare system? Did we bring down the cost? Did we drive the quality of care into those rural communities for public health? Are people getting care that they never had before? If you unplug this, will people get hurt? That'll tell you how valuable what we do is that people need it, right? At the end, even in the finance of healthcare that we play in that space, if we reduce the cost of care to keep a hospital open in a rural community, if you unplug us, will that hospital close? That'll kind of tell you how important the automation is.
And I think from here, it's like I'm leaving here. My job is now to show other students and younger people like the difference in how technology and healthcare can change the world. So when we go to campus, we'll show everybody how it works and not to question these.
I say it's exciting. What I would say to the students, University of Miami and across the nation, University of Arizona, where my youngest daughter will be going next year. I would say keep optimistic. You're in the right time, in the right place. Growing up in a time of transition. Imagine if you grew up and you were coming out of school during the time as internet was evolving. And now you got AI evolving at the right time. So this is going to happen for the next 10, 15 years, where you'll have such huge opportunity. I would say that keep focus on a problem and solve it, right? With AI. Don't just look at it from a land grab, a money grab. Look at a problem, address the market. How big is the problem? And then fix it. It's not going to just be us trying to fix it. It's going to be the future of our children.
Awesome. Thank you.
All right. Thanks,
Okay.
Emily Lowe.
Cool.